Welcome to the Health Admin Life podcast. My name is Brooke, and I'm going to interview special guests to explore the vast career opportunities in health administration. Whether you're a clinical professional, a corporate worker, a student, or a patient yourself, this podcast is for everyone. Get ready to be inspired. Hello, current and future healthcare leaders. Welcome to the Health Admin Life podcast. My name is Brooke, and today I would like to welcome you all to the first bonus Q&A episode. So on Spotify and Instagram, I sent out a survey to find out what your pressing questions were and how I can help answer them. So today we're going to answer the top 3 questions, which include what is health administration and the differences between admin and management, how an MHA has benefited me in my role, and what has life been like after college. So for the first question, what is health administration and how is it different from management? I think this is a great question, and I have made previous videos on TikTok about this, but essentially there are different fields. So we have health administration or healthcare administration, healthcare management, health systems administration, or hospital management, and there's different types. So you can go into leadership, management, public health, healthcare systems, hospitals, hospital networks. Then there's 3 different sectors: primary, secondary, and tertiary. And within those sectors, you can go into hospitals, long-term care, consulting and medical sales, academic medical centers, government, destination medical centers, and the list goes on. It's hard to name them all, but essentially your roles could vary. You could be doing long-term strategy, working with operations, but your ultimate role is to take care of those who take care of patients, whether this is enterprise-wide or just within a specific department. Now, for the differences between admin and management, there are differences, but people end up using them interchangeably. I would say admin essentially could be the overarching big picture needs, system-wide initiatives, but management could be those day-to-day operations or staffing. Some people say that admin is higher, but it really depends on the organization. So don't take what I'm saying is verbatim. Again, I've made a few TikToks on this, so please look at those for further information. For the next question, question number 2, it says, how do you feel pursuing your MHA benefits you in your current role? In general, I think an MHA degree really helps students and professionals accelerate their careers and take on leadership roles they wouldn't have the opportunity otherwise. I would also say that this could help you stay up to date on current trends because so many things change within the healthcare delivery system, whether it's laws, regulation, new technology. But in short, an MHA has helped me gain an understanding or a deeper understanding of what healthcare delivery is. It's helped me develop more of those core competencies, whether it's hard skills, soft skills. Hard skills might be those finance, those accounting or finance classes that you had to take, or you could say strategy frameworks, but soft skills could be public speaking or developing relationships, or I would also say other things like creative thinking, innovation. But essentially, I would say an MHA has helped me become a better, effective leader to help patients. So on top of that, I would also say that it has helped me gain the opportunities that I wouldn't have otherwise by networking with more people, and also have the opportunity to have higher paying jobs with greater leadership responsibilities. A cool fact too, just to think about, is that the healthcare industry is growing. So according to the Labor Bureau statistic, healthcare jobs are supposed to increase 15 to 20% in the next 5 to 10 years, which is great. So just something to think about if you're looking into an MHA, this could be a good opportunity for you. Now, an MHA isn't just the only answer. If you want to go into leadership roles, you could also do an MBA, an MPH, or an MS in a related field like systems engineering or industrial engineering, which I have worked with coworkers who have those kinds of degrees. But you could major in just about anything. But the higher up you go, I would say a master's degree is normally required unless you have like 10 plus years of experience. But something to consider too is that with these degrees, there's different focuses. So the first step would be selecting the right program. And that is really focusing on your strengths and what your long-term goals are and preferences are. From there, you can select your degree, and that can play to filling those knowledge gaps that you have. And then lastly, to answer your third question, what has it been like after college? What has my life been like? So to explain life after college, it might help to explain a little bit about me and the decisions I've made throughout the years. Hold on one second. So I would say ever since I was little, I had a passion for healthcare. I grew up watching so many different medical shows like Untold Stories of the ER to Grey's Anatomy, and I knew I wanted in on the action. The only problem was that in real life, I'm not great with blood. So I wanted to help others, but didn't know how. So I ended up volunteering a lot of different ways. One of the main ways was volunteering for Toys for Tots at my local health system. From there, I had the opportunity to actually intern at that same company and also work at their call center. So this was a great foot in the door. I also worked at different urgent cares part-time, which also had a built-in primary care and cardiology office. So great experience. Highly recommend volunteering or doing part-time jobs to gain experience. But after that, I was able to intern in supply chain, strategy operations, continuous improvement, gastroenterology, and also other call centers. With my most recent experience, those have all led me to working as a strategy fellow, where I have helped to develop and execute innovative healthcare strategies. In the future, I am eager to build upon these experiences to really close gaps in care and help patients wherever I can. That is a little bit about me, and that's what life has been like after college. I did get my master's. I have done a fellowship. I've done internships. And if you have any more questions, please feel free to always message me. I can incorporate them in the next podcast. But I hope you enjoyed this first Q&A. If you would like to continue listening to more episodes, please check out the link in my bio at Health Admin Life on TikTok, Instagram, or YouTube. Today's show is brought to you by our sponsors, Riverside and Anchor by Spotify.